Hello, you're watching Health Day Now. I'm Mabel Jong. When COVID-19 began pummeling the US almost 3 years ago, it was the healthcare workers that pulled us through the fight. Now, rising levels of burnout and job dissatisfaction are creating what some have called a great resignation of providers. The effects are troubling. 1 in 4 Americans say they've been impacted by recent healthcare shortages, according to a new survey from HealthDay in partnership with the Harris Poll. To get a handle on the ongoing difficulties caused by the pandemic and what needs to be changed to address a growing crisis, we spoke with a provider who has been on the front lines. Joining us now is Nurse Kelly Morgan, the chair of the Massachusetts Nursing Association at Brigham and Women's Hospital. Kelly, thank you so much for joining me.
Thanks for having me. I appreciate it.
Nursing has always been a tough job, stagnant pay, challenging patients, general understaffing, and then add to that the strain of working through a pandemic. Can you describe the impact of COVID on you and your colleagues?
We were the front line. We were the people that were fighting this pandemic and be exposed every day. And so the triggers that come along with that are, the constant stress and mental fatigue, physical fatigue, in essence, like a PTSD from that environment. And unfortunately, part of that hasn't changed as we are, almost 3 years into it.
We're seeing some positives. Access to personal protective equipment has certainly improved, and vaccines and medications like Paxlovid have been beneficial for patients. But what about the morale of healthcare workers? Has that returned to more positive levels?
I think because staffing hasn't changed, if anything, it's gotten worse since the pandemic. I think the pandemic was a huge trigger for a lot of nurses that felt unsafe, unsupported, and undervalued by the hospital administration. In many hospitals, people felt like, you're throwing us to the wolves and you're not helping us and providing us the necessary resources that we need, the personal protective equipment, that sort of stuff. So, and it still hasn't changed 3 years into it. Our nursing turnover is huge. People are leaving for various reasons, whether it's they were completely burnt out and from the pandemic and the care that they had to deliver, and they're like, I don't want to do this anymore. And then it is the burnout, and it's like, either I don't want to do bedside nursing anymore, and I'm leaving the bedside and work in an ambulatory clinic, or I'm going to do something, or I'm going to completely leave nursing as a profession at all, because this is just not what it was like to be a nurse before.
When a nurse is burnt out, how does that impact the patients?
I'm sure it is in ways that I'm not even recognizing. I think, we try, like I said, we try to go into the room and leave everything that's happening outside of that room out there, so we can go in and take the great care of our patient that the patient deserves. But I'm sure that there are days that people aren't as cheerful as they normally were, don't feel as compassionate as they did, even though we're trying not to deliver that message to our patients. It is trickled down to every single discipline. And if you can do a telehealth appointment, you'll probably get something in the next week or two. But as we know, things like mammograms, CAT scans, you need to be going in person. And it's just halted the care delivery system. And that's why so many people are showing up to the emergency room to have their primary care, because they can't access the services in a certain time frame.
Do you think people are getting sicker as a result of not being able to access care in a timely fashion?
Absolutely. People are showing up in the emergency room where if they had been able to access care 3 weeks before that, they wouldn't, and maybe they did get COVID, and they could have gotten their treatments, the 5-day medication treatment, but they didn't. And now here they are 3 weeks later, sick with COVID pneumonia, requiring, respiratory support and an admission to the hospital.
According to data from a Harris Poll survey, 88% of Americans report that they think of healthcare workers as heroes. But more than 52% agree that working as a healthcare provider is not as highly respected as it once was. Kelly, how have these sentiments been felt in the workplace?
We don't need adoration every day. We're not asking for that. We're asking for the proper staffing, equipment, space, and resources to take care of our patients safely on a daily basis and provide the care that we have always been able to provide them without them knowing that we're facing these challenges. I walk into a patient's room and I want my interaction, however long or brief it is, for them to get the best care from me without me having any other distractions, and them not knowing that maybe my assignment is doubled. I don't want them to feel any of that. And I think nurses across the board do an excellent job as not letting their patients know how stressed we are and the challenges we're facing outside of the room, because we try to leave it at the door when we go into the room.
You have decades of nursing experience, almost 30 years. Have you had days when you've just wanted to give it all up and quit?
More than I care to remember in the last 2 years. Before that, I came into work every day. I would be, I loved my job every day. I was thinking, always used to think, I am so lucky. How am I so lucky that this is what I get to do for a living? And I have not had many of those days in the last 2.5 years. And that's disheartening, because a nurse goes into nursing because they want to help and they want to take care of people. They want to nurture and make people well again.
Yeah.
And it hasn't felt like we've succeeded at that.
Kelly Morgan, a labor and delivery nurse and Massachusetts Nursing Association chair at Brigham and Women's Hospital. Thank you.
Thanks for having me. I appreciate it.
To further discuss the impact of the Great Resignation in healthcare, I'm pleased to have Brock Slabach with me. He's the Chief Operations Officer for the National Rural Health Association and has over 21 years of experience as a rural hospital administrator. Brock, thank you so much for joining me.
Thank you. It's great to be with you this afternoon.
We just heard from Massachusetts nurse Kelly Morgan about how healthcare workers, specifically nurses, are burned out following 3 years of battling COVID. What healthcare positions have you seen hardest hit by the Great Resignation?
Certainly, the nursing profession has taken a large hit in terms of workforce shortages. In addition to that, the practitioner level is also in great demand, both nurse practitioners, physician assistants, and physicians. This constellation of provider shortage has created huge gaps in the ability for hospitals to serve their rural communities in an effective way.
Could you tell us how COVID has affected staffing availability for rural areas in particular?
The shortages of workforce in the rural area has existed long before the pandemic. If you look at the statistics regarding the presentation of the constellation of providers in rural areas, they're far less than their urban counterparts. Then the pandemic hit. And so because of the increased demand for these professionals, then all of a sudden the wages started increasing. We saw the influence of agency nurses that started to, and contract physicians that started to increase demand for services. And so then we saw this downward spiral, if you will, of workforce going into those elements of service. And then leaving rural hospitals and clinics very much short-staffed.
And what has the impact of these staffing issues been?
What's happened is that the facilities have scaled back their ability to admit patients who provide care according to their ability to provide that care. We're anticipating some very rough days ahead in terms of hospital closures, hospital finances, which could lead to closure.
Clearly, there are difficulties that rural healthcare systems were up against prior to the pandemic, but how has COVID amplified these issues?
Income levels are lower in rural as opposed to urban. You have more people on supplemental nutritional assistance programs per population in rural areas than you would in urban. Chronic disease, more incidence of that. And so when we went into the pandemic, the virus was beautifully designed to exploit all of the weaknesses that we've had in the rural environment. And so those chronic conditions, the poverty, the lack of access to healthcare combined to create a much higher mortality rate for per 100,000 in population in rural areas than in urban.
What do healthcare systems, particularly those in rural areas, need to do in order to address these staffing issues going forward?
First of all, I should say that rural areas make up 80% of the land mass of the United States, and we only have about 17% of the population living there. So when you're looking at planning for health services, obviously you have large distances with few people. So we need to have the tools that are required to be able to serve those individuals appropriately. So some of the things I advise communities to look at is community health needs assessments, looking at a broad base of stakeholders that are coming together to determine just what the community needs in terms of goods, in terms of services related to healthcare. And then once the community makes that establishment in terms of a plan, then that plan can be carried out. And so in the area of recruitment, obviously you would need to have all hands on deck. We call it recruitable communities. What can you do in your community to make yourself a more recruitable community to someone outside looking to move there? So that might mean that you need to provide better housing. You need to look at the housing stock, the inventory of housing that's available for people to move into once they decide to locate in your area. It could be simple things like making sure that the practice environment for the physician or the nurse practitioner or physician assistant is adequate, and that it is really it gives the employee the sense of having a job that they want to come to.
Once you've recruited the healthcare workers, how do you retain them?
Well, you have to do several things. First of all, you have to make sure that you maintain competitiveness in terms of pay. That is the first point. The second point is, again, creating a culture in the organization that allows for the employee to thrive in the practice that they've chosen to be in. And this means that really looking at all of those policies and procedures that would detract from somebody that would want to fulfill the mission that they have in their lives to serve people.
Have there been any changes made to healthcare system practices during the pandemic that you think will be beneficial to rural healthcare systems in the long term?
Rural communities are complex. And so when you look at a hospital in a community, it may be that it's 15 minutes or 20 minutes to another hospital. It could be it's 2 hours. And so you can't make a prediction in terms of location. Certainly when you go out to places like in the West, Montana, Wyoming, Kansas, Western Kansas, you have long distances between facilities. And so when one of those closes, it does then make the drive for more people even longer. And so that is problematic.
All right, Brock Slabach, COO of the National Rural Health Association. Thank you so much.
Thank you.
Thank you for watching. For Health Day Now, I'm Mabel Jong.